We are meeting for the education program module second. So today we will have presentation on recognition and early signs of injury. It will be presented to us by Dr. Mohit Gulati. He's a physiotherapist currently at NCOE Lucknow. So I would request Mohit, please presentation शुरू कर सकते हैं. Thank you.
Thank you, Dr. Blessy. I'll just ask if I may stop my video for sharing for the better network issue. So good afternoon, everyone. I'll just start my screen, and I may not be visible to you, but if there would be any issues, you can tell me at that time. Thank you. Is it audible? Am I audible and my screen is visible to everyone? Is it?
Yes, it is.
Yeah.
Yes.
Thank you. Okay. So today's our topic is recognition of early signs of the injury. First of all, I would like to say there are few quotes which are very famous in sports industry. One is there are more. There's like no pain, no gain. We all know about it. Another one is rub some dirt in it. या फिर हम लोग हिंदी में कहते हैं कि या पंजाबी में कहते हैं मिट्टी पाओ ते आगे बढ़ो. ठीक है? No guts, no glory. But my real question is, does it imply to all kind of injuries? Is it always the same thing that we see कि अगर pain है तो that even though also we have to move on? Is it a good approach to ignore the pain always? So today we are going to talk about this thing, how to recognize the injury. But before moving on to that, we shall know what are the sports injuries and how we can prevent it and how we can recognize it. So the sports injuries, simply according to the manual of International Olympic Committee manual also, it has been mentioned that any injury which is a result of any sports exercise. But others also say that sports injury has many terms, which could be including mechanism of injury, is it present in the individual, or any injury have been or shall be managed previously, or how it shall be managed now. So any injury result of a sport exercise. Okay, mostly a sports injury is considered as musculoskeletal injuries. That means bones, ligaments, any soft tissue injuries, muscles, tendons, bursas, your joint structures, and sometimes head injuries known as concussion. Okay, so sports injuries could be because of overtraining or undertraining, lack of warm-up, or lack of conditioning. Okay, so we shall be talking about all these things. Let's start the classification. First of all, the classification of a sports injury has to be seen through certain things. First of all, the time taken for the tissue to become injured. How longer this tissue have been injured, or is it the acute injury, just sudden injury, or is it the injury which has occurred in the past, or is it becoming gradually the pain is increasing? The type of tissue is involved, like is it a bone, ligament, muscle, meniscus, what kind of injury is there, the severity of the injury, so that we can know is it a mild, moderate, and severe, so that we can manage accordingly. And the next thing, how the individual is presenting that injury. Okay, that these are all the things we need to consider, including mechanism of injury and onset of symptoms. That is one of the very important thing that we need to know. Is it the onset of the symptoms have been very old, which have been increasing gradually? So that means it could be a part of overuse injury or a very chronic injury. Or is it a sudden injury that happened on during training or during exercise? So we shall be talking about the classification. First of all, the classification is acute and chronic. That is it a recent injury or the past injury? Type of tissue involved, the bones, hard tissue involved, or the soft tissues involved. The direct injury or the indirect injury. Direct injury means the person, the athlete, have been met with any accident, any trauma, or is it an indirect injury that occurred while playing or something, like twisting or anything, and an overuse injury which has been coming from a past few days to few months and increasing gradually. Okay, so these are the sports injury we have just discussed, the classification according to the cause, body tissues, and duration. Now there are few sides of the injuries, and there's a small classification of the acute injuries and overuse injuries. Acute injuries, as you can see in a bone, there is a fracture, whereas overuse injuries is a stress fracture or bone strain or periosteal reaction. These are the things. कभी कोई किसी चीज से हिट होता है तो हमें फ्रैक्चर हो सकता है, हमें वहां पे स्वेलिंग आ सकती है. बट इफ दिस इज, अगर ये बहुत प्रोलॉन्ग्ड है, इट इज वेरी प्रोलॉन्ग्ड एंड इट इज हैपनिंग टू योर fracture sites, and it has become very tensed with your bone, or it has become very your bone has become fractured because of those stress, that is your overuse injury. That is your overuse injury. So we need to understand what is an acute injury, what is an overuse injury, because acute injuries, the recognition of acute injuries are very simple, that you can see in front of you that it has just happened. But overuse injuries can be ignored many times, and that can be very dangerous for the person's recovery or for the even sports as well. So we will be overviewing this overuse injuries in this lecture. Articular cartilage, the cartilage, that means any joint structure is involved, any cartilage is involved. That means whenever there is a cartilage injury, cartilage fracture, that means it could be acute. But if there is chondromalacia or anything which is occurring, that is chondropathy, which is overuse injury. Joint dislocation, subluxation, these are your acute injuries. Whereas in overuse injuries, these are your osteoarthritis, overuse injuries, synovitis, inflammation of synovial membrane, the ligaments. Any tear is any type of tears, grade 1, grade 2, a sudden movement. It could be sudden twist, could be your acute injury. But when we are talking about overuse injury, there could be a prolonged pain due to inflammation over there. Muscles, tear, contusion, cramps, and very important thing is this compartment syndrome, acute compartment syndrome. This acute syndrome can lead to this acute compartment syndrome can lead to even very dangerous consequences. So whenever there is a very massive swelling in a muscle or in a limb, that shall be always shown to the doctor and referred to the higher centers, because it can lead to the injury of the nerves, blood supplies, and even death of the cellular tissues, which can lead which can have a very bad consequences to the leg or to the limb of the athlete. If it is the chronic, then it is not uh, not very dangerous, because that means there's a compartment which is being involved for time to time, and it is not becoming very severe. But sometimes the pain can be like sensation of the pain could be uh, numbness, or some of the types of pain that patient is saying that I am unable to feel the strength, it is very weak, I'm not able to take a load on it. So we have to check whether it is a muscular or the compartment. So for that also, a doctor or a physician is a better person to check and go for it. Delayed onset muscle soreness is also some types of overuse injuries, some types of acute as well, because whenever we have started exercises, after that the lactic acid gets accumulated, and sudden exercises, then it can give within 24 to 72 hours a muscle soreness. That is good. But if a person is not getting recovered, then the muscle soreness is can be a bad sign. So we have to know what are the differences between. So that's why the injury, whenever there is an injury, we need to remember the mechanism of injury or the history as well. Now, tendon, tear, or tendinopathy are both the different things as the ligament. If there is any tear, that means it could be acute, and if there is an inflammation, that means it is overuse. Bursa, traumatic bursitis or bursitis, if there is any trauma and included the bursa and other soft tissue structures, that would be acute, and overuse will be your bursitis. Nerves, again, could be any nerve entrapment or any acute injury that occurred with the contusion or anything, and there's a pain in the nerves, numbness. That means there is a nerve injury or any cut to the nerves. But if there is mild irritation all over for a few times in a day or for few months, that means the person is having some nerve entrapment. Skin laceration or abrasions can be there as well. So we shall move to some of the um, examples that you can see. This is the chondral junction fracture. This is an acute injury, costochondral injury. But if there is a very slight inflammation is there and swelling is there, that means it is an overuse injury or because of any trauma which have been occurred before. So we have to consider all these things to understand. This is one of the very major and missed condition known as periosteal reaction, which is caused by overuse injuries in the limbs. And this is like, if you can see over here, this is a very big swelling you can see, but in this area you cannot even see a very much. On the left x-ray you cannot see very much injury, but this is actually, this is one of the very important signs to understand if a person is having an athlete is having pain for continuous many days, and whenever stress is given and the pain is getting worse and there's a swelling and bone tenderness for a long time, then we need to understand that there could be some periosteal reactions which are not easily visible. Okay. Now, just over the ankle and over the TA tendon Achilles, we will be I'll be just sharing some of the ligament, some of the areas which can get hampered, which can get inflamed, which can get teared also. Just over this area, there are so many complaints at this area with the athletes, even they are runners or even they are uh, weightlifters or martial art players. So we need to just understand what could be the things just in this area. So if you can see, it is peritonitis. That means the inflammation of the uh, tendon without involving the synovial joint. There would be some hardening over there. So we can check it at this area. If the hardening is over the calcaneum, so there could be a, and if while stretching you are feeling some of the burning sensation, that means the bursa is also involved. There is a retrocalcaneal bursitis. There could be a insertional tendinitis as well. So it would be very painful even just after touching. The tenderness will be very much. So we can see these three. And when there's a tendinitis, you can see the area which can comes towards this talus. The tendinitis could be there, the tear could be here, the tendon tear, and there could be some tendinosis which have tiny tears and which gets inflamed later on. So this is one of the very common site of the injury for any runners. So recreational runners or any professional runners, all are having these kinds of injuries, most common. Then what is overuse injury? Overuse injury, whenever we are giving so much of overload to any tissue, so it becomes a vicious circle. That vicious circle is like a tissue injury goes again and again and again and again, and that wear and tear trauma becomes a overuse. So what happens that whenever we are giving a overload, that tissue injury occurs. If you're continuing that activity, it will give pain. That pain increases the inflammation, and this inflammation again gives more tissue injury. So this becomes a vicious circle, and tissue injury gets more and more, and gradually it becomes worse. And that's how the patient or the athlete starts feeling that unable to perform certain kinds of activities which he or she was very pro in that. So that means the performance drop is could be there also. If we can just give some rest and proper periodization or proper recovery would be given, and early recognition of these kinds of injuries can enhance the performance and can enhance the uh, can promote the injury prevention. So we need to understand when there is a overload. So that's why I always say that is it always uh, pain is always bad. So we need to understand what kind of pain is there and how the mechanism has been happened. So there are some examples of the overuse injuries. If you can say in a bone, there's a metatarsal stress fractures, MTSS in runners, Osgood shelter lesions on jumpers, gymnasts. So there are some stress fractures to the bone, tendons, Achilles tendinopathy in footballers, patellar tendinosis in volleyball players, that is jumpers knee, joint, any slap lesion, functional acetabular impingement. So there could be so many things we have discussed previously also. So these are certain examples. Now, this is one of the very important thing I wanted to share. Uh, See, in a recent research, around 455 papers, some researchers have found that stress fractures or stress injuries are the most common injuries among other sports injuries. These injuries are more in adults from 19 to 65 and more common in sports activities, as you can see over here. Okay. And these are not just in males, but these are very common in both of the genders. Yes, the males are more involved. That maybe because of the males' involvement in the sports are highly increased all over the world. But the population is not just in a uh, professional athletes, it is in a recreational athletes as well as in a military, which are found very high proportionate that these three categories, these three populations are more into the stress fractures or stress injuries. And more commonly, if you can see that the most highest probability of stress fractures are in the lower limb, followed by foot and ankle, then pelvis, spine, and upper limb. So this is something we need to understand, that how overuse injury can affect someone in a gradual manner, and these legs are very much involved in this. Most common sports injuries, as we have already talked about it, ankle sprain, internal derangement of knee, that means involvement of one or more than one ligaments or any other structures of the knee, which is very common. We all hear ACL tear is very common, ACL tear is very common. But with the ACL tear, but with the ACL tear, but with the ACL tear, uh, there are other tissues which are also very much involved. So muscle pulls are there, dislocation is there, tennis elbow, golfer's elbow, most commonly seen overuse injuries, which can lead to surgeries as well. Shin splints, as we have just talked about, over the shin, there could be stress fractures also, but before the stress fractures there are shin splints. That means the muscles and the tissues and the fascias are of this shin are very much tight or are in a painful condition. If we can prevent it at that time, then we would be able to prevent it from stress fracture. Contusions are something which are very common in sports. They can be from the trauma, from the kicks, from the instruments like balls, hockey sticks, anything. Now, the risk factors, we have two kinds of risk factors, intrinsic and extrinsic. Intrinsic risk factors are the risk factors which comes from one's own body. So it could be age, strength to weight ratio, postural instability, so many things are there. And extrinsic, which cannot be controlled by one's body, but it uh, comes from the outside of the environment. That means it could be your equipment, it could be your sports specific, could be another person, and the mechanism of injury. All these three things involves a injury. So intrinsic factors are the predisposed. It is at the predisposal of the athlete. That means that athlete may modify it or not. Extrinsic factor, that is very susceptible for the injury, for the sports. That means they are more there are more chances of getting these things. And then mechanism of injury, if there is any dynamics in which there is a twisting of the twisting incident happened or any accident happened, that means it would lead to the injury. Now, intrinsic risk factors, muscle imbalance, as you can see over here. It is not just a muscle imbalance from one part, but agonist and antagonist muscle should be balanced also, because there is a very important need of the eccentric contraction as well as co-contraction of the muscles for better stability. Postural defects, as you can see in the picture also, this that stoop posture, these types of postures will obviously alter other biomechanics, which would lead to the more injuries. Overuse injuries, there are so many areas which can occur as a overuse injury. Age, according to the Wenberg et al. In a research, they have mentioned in a 2012 that there are two predisposed ages, uh, at young and at old. Especially young athletes before 14 years are more susceptible for the injuries, as they don't know their own limits, so they try to push their limits. And again, the same thing occurs with the athletes above 30 years. They are more susceptible for the injuries, as their injuries, as they know their limits, but because of decreased their conditioning or decreased uh, reaction time, they try to push their limits and to reach their goals, which can hamper their which can increase the chances of the lifestyle. Now, limb discrepancy or any bad technique can be also there, which could uh, be a very important aspect for your injury. In para athletes, we need to understand this thing, how we can try to cope with this, how we can try to make their balance. Similarly, inadequate warm up and cool down is also a very important factor, that 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 is a intrinsic factor which causes a injury. Now, what are the extrinsic factors? Extrinsic factors could be your equipment. First of all, equipment could be anything. It's not just it could be very thin grip or very thick grip. It could be, if you can feel it. If there is a ball with a too much of air inside, it will be hitting you very hardly, and if it is very soft, then you need to hit it very hardly. No, so both the ways it can hamper. Similarly, the strings of a racket, if it is too tight, it gives you a very bad pressure, and if it is not too tight, it is very light, then we have to use too much of pressure to uh, for a shot. So similarly, we have to understand the equipment, and we need to use the correct equipment. Others players, that is a very common injuries, can occur in a semi-contact and combat injuries. That other players can get collision injuries are there. Concussion is very common because of this. Contusion injuries. Environmental factors, there could be in environmental factors could be so many. First, if you think that if you are living in a very cold climate and you go to a very hot climate for a competition, that can uh, without any adaptability, that can lead to an injury. If you're practicing on a mat surface, and suddenly you're asked to go and play, and there's not a good mat or something, then it can also lead to the injury. So there could be so many environmental factors or equipment factors that we need to take care. Then training load, proper periodization, proper recovery should be there, because over stress, as we have already seen, over stress is the main factor which is like very common for the injuries. Then wrong technique, person need to understand that the technique of doing this is like they need to correct it biomechanically or physically, they have to correct it. Otherwise there would be a intense pressure to other areas which will get hampered. So these are the intrinsic factors. We have already discussed about all these intrinsic factors, so there are certain examples of that. Now sign and symptoms. Sign and symptoms: pain, sudden severe pain or dull ache at rest, or any pain which starts with the activity. So that is a very commonest sign. Okay, so we need to understand, is it very severe, or if it is not, then what are the things we can do with it. And if any physician or anyone have asked an athlete to try to stop, that means they must have seen uh, some of the injuries के कुछ ना कुछ उन्होंने वो देखे होंगे, that it can lead to a more worst injury. So you need to take rest if someone has told you. So always try to tell the exact type of pain and what kind how severe is the pain is. Okay. Then swelling, if it is a sudden swelling or gradual swelling within 24 hours, it could be a very severe problem. So we need to check that as well. Redness over the area, as you can see in a above picture, that there is a redness, or some of the bruises or lacerations can also be there. Reduced mobility, that athlete can himself or herself say that I'm not able to move fully or freely. You can also check passively or actively. Is there any decreased range of motion or not? Tenderness, while touching, is the pain too much, too tender? Uh, Weight bearing, is the person is able to bear the weight on that or not, or is the patient is the person is able to hold the equipment or not. So we can understand with it. Then extreme limb weakness, this is one of the very important thing we need to understand. Sometimes person does not feel the strength in their limbs. No, they always feel that it got numb, or there is a weak arms or legs. That could be because of some injury or because of certain other weaknesses or some other pathology undergoing. So we shall always discuss it with to the doctor. Then deformity. If you can see over here, a visual deformity can be seen. That means it could be very that means it had some injuries in the past, or now recently it had got injured. So we need to understand the deformity also. If there is any unusual thing you can see, you can go to and meet the doctor for the same. Now diagnosis, as I have told you, physical examination is very important, that we have to check uh, that this physical examination, active range of motion, passive range of motion. We also need to check what are the severity of these examination, or there are certain other physical examination which can be done by the physical therapist, or the physician.
फिर 2 दिन बाद बढ़ जाएगा। सुनो, इसको पूरा आज कोटा करके 3 दिन कम से कम लेजर पूरा हो जाएगा, सेशन इसका फिनिश हो जाएगा। 5 मिनट लगेगा।
Please mute yourself.
उसको पूरा सेशन हो जाएगा ना, फिर दोबारा नहीं होगा। इसमें क्या होता है, आज ठीक हुआ फिर चलाओगे फिर आ
प्रहलाद जी,
जाएगा।
प्रहलाद जी,
please
आप
mute
म्यूट कर दें
yourself.
प्लीज।
Prahlad sir, please mute yourself.
Yeah, thank you. So physical examination that you can check, and not only these physical examination, but there are proper physical diagnostic tests for any kinds of injury like a meniscal tear or any muscular tear or ligamental tear that can be assessed thoroughly by a physical therapist or sports physician. That can be checked. Then medical history is very important to understand. Proper history taking is very important, that how long the person has been injured, what kind of injury is there, and then other assessments like x-rays, investigations like MRI, CT scans, any other blood test, that is very essential to understand whether there is any other pathology which is occurring because of that there is a injury. Now, the physical examination are two steps. It's a very common thing to understand. Talk to the athlete, observe the area for anything, swelling, redness, visual deformity, holding of limb if person is not able to hold their own limb by itself and supporting from the other limb. That means there is something which is very important to understand, that it could be very dangerous or some pain is there. Type and type of pain, touch, if there is any localized temperature is there, sensation, pain is too much or very or too much tenderness. Okay. Active movements, we shall always check the range of motion actively. Passively, we can check is there anything that the movement is at what movement or at what range there is too much pain. And we can as a physiotherapist we can also feel the end feels, is it bony, leathery, so what kind of structure is involved. Then skill test, this is very important, which can be done on field if the player got injured. So we can check active movement or passive movement instantly. And if a patient is not able to demonstrate it, then we can ask for the uh, game specific skills like holding a stick or moving a stick or hopping, triple hopping on the ground. If patient is of if athlete is not able to do it, then we shall always ask the athlete to that you shall all that you should be removing from the that athlete should be removing from the game, and other athlete should come in place of him or her. So these are the red flags, very important to understand. If there is a pain associated with limping, swelling, or any drop in performance, are the basic red flags for any sports injury. So if a pain lasts for hours or days after the practice of competition, that is one of the red flag that you always go to see to the doctor. Pain that does not go away with the rest or gets worse over time, this is also one of the very important sign to understand. And if even if a pain gets triggered in the normal daily activities like walking, climbing stairs, is something that we need to understand, or even lifting something from a cupboard, wear clothes, that means these are the certain things that we always need to understand, that these are the red flags. We always go and see to the doctor. This is not normal. If there is a rapid immense swelling is there in any part of the uh, joint or any part of the limb, that means it is also not normal. So we need to go to see the doctor. And then skill test, that if a person is not able to do certain simple skill tests like standing on toes, walking on toes, hopping or triple hopping or any other game specific, that means these all things are not normal, and the athlete should be go for the investigation and go for the doctors. Now, the Now last, it is the prevention. We have already talked about certain intrinsic and extrinsic factors. So so adequate warm up is very important. Adequate warm up, it is always been said that warm up should be always dynamic, but in 2020, in 2012 there are certain sorry, there certain researchers have found that dynamic warm up are good for the practice, but static stretching is also good. Static stretching below uh, static stretching less than 40 seconds does not actually significantly reduce the strength and performance. And this is actually all this static stretching is a very controversial thing. Some say that we shall not do it even for 5 seconds also before the warm up. But in certain researches, it has been shown that up to 40 seconds they can do, especially for the bigger group of muscles like quadriceps and hamstrings. Does not hamper their strength. Similarly, adequate cool down is very important. The cool down should be always gradual. It's not like a person shall stop suddenly and start stretching. If the activity has done, so for the recovery they need to stop uh, gradually, like after running, then they can walk, back walk, they can like jog, they can uh, do side walks. So for that, their heart rate gets slowly cooled down. Okay. It can also involve static stretches. Protective gears, always use a protective gear to uh, always use protective gears to reduce the risk of the injury. It is very important whenever you're using the protective gears, or there are gears which are actually a part of your game. You shall always use those protective gears like head gears, chest gears, everything. Now, proper use of equipment, it reduces the risk of overuse injuries. It is very important to understand, as I already said, too much of air in a ball can is a very big risk for the contusion injuries. Similarly, very thick grip is also a very big risk for the injury. So we need to always ensure how to use the equipment skillfully. And proper nutrition, it is also very important to understand the nutritional values, and especially I must say the hydration is very important to decrease the risk of many things. Athletes shall always drink proper water. The proper intake of water is important. These reduces the risk of cramps, exhaustion, even fibrosis, or the fascia tightness. So everything is very important with the hydration. Prevention, proper taping and bracing can be done for the to ensure more safety. Strengthening, proper group of proper muscle group of strengthening should be there, like agonist, antagonist. The balance should be there, as we have already talked about it, to withstand most pressures from the opponent, and to produce more pressure as well. Proper conditioning should be there for your endurance. Biomechanical correction can be done by just correcting, by just taping, or correcting some of the uh, bone, by just implanting some shoe correction, or doing some small bracing or taping can be done. Proprioception and balance training are very important to be done. These always helps the athlete to understand their weight bearing position as well as their dynamic movement whenever there is there. And reaction time training can also be there, which increases which always improves the game skills and eventually helps in reducing the injury. uh, thank you, that's all from my side. If anyone has any question, can ask.
आप लोग के पास कोई भी क्वेश्चन हो प्लीज अभी पूछ लीजिए।
जी नमस्कार.
जी नमस्ते सर.
मैं taekwondo coach from Bangalore side.
Yes sir.
Sir, the question is related to shin splint. Normally we face in training. So, what is your take on when the athletes have shin splints? What should be our protocol as a coach? What should be the definitely we will be sending him to the doctor and all that, but then that will not be the complete solution of it. क्योंकि कहीं ना कहीं we have to take him to the training. नहीं तो अगर hostel में रहेंगे in the complete rest, so they are normally demotivated. और वो बहुत ऐसा देखा गया है कि when they have shin splints, basically the advice from the doctor is in MTSS की जाके आप पूरा रेस्ट लीजिए, since it is a mediotibial stress syndrome, आपको दवाई लेनी है and the whole set of course goes for at least 2 to 3 weeks complete rest. So I just want your take on this.
Gautam, it's a very good question. I just want to ask you certain things. Whenever I'll just tell you certain things. Whenever there is an injury to the MTSS or any shin splint is there, first of all check the hydration of the athlete. It's very important. Either he is having that recovery period, and for the recovery there is a better there is a very important to have a good hydration. First of all, second thing, MTSS is not just from just that there is a shin pain, or it will be occur from the shin stress also. It can also occur because of IT band syndrome, that there's a tightness of IT band, or there is a involvement of glutes muscles which are weak, or some other biomechanical correction need to be done. So if there is uh, proper physical examination would be there, so that can also help. If someone is having shin splint, can be prevented before it's happening from correcting these things. I just give you one example. There were 3 athletes from taekwondo from here itself. They were not taking too much of water, and just by giving them a proper water, by forcing them to drink water inside the taekwondo hall, they have been improved from it only. So we have to just check whether there are other structures also not to be.
And thank you very much. One more thing I'll ask you. I mean, very nicely you explained about that Achilles tendonitis, what normally we face. A lot of footwork is involved in taekwondo training. So some of the athletes, when they suffer with this Achilles tendon pain, so how should we go about it so that they can which are the exercises permitted, because no jumping and all is involved, and what should be our role in helping the athletes to get recovered?
Okay, sir. So similarly, if the fascia is tight of the calf muscles, then we have to first ensure that the calf muscles get fully there should be myofascial release of those muscles involved. Then if there is a tendonitis or tendinosis, we need to check that, and some proper calf stretching is also very important. No, and other than that, so as we know that there would be always involvement of the your in kicks and landing. There would be some of the use of the calf muscles, more of that. For that, sir, if there is a recurrent injuries are occurring there, so we can tape to that athlete also prior to their practice. That shall reduce the risk of the injuries at that time.
Fantastic, sir. Thank you so much.
Mohit ji, good afternoon, and this session was very good, very informative and very useful, dear. मैं अभी देख रहा हूँ कि कुछ मैं बेंगलोर से बैडमिंटन के इसमें से बोल रहा हूँ. हमारे इसमें जैसे कोई अभी मैचेस वगैरह चलते हैं तो कुछ बच्चे जो हैं दे गेट कोविड इन्फेक्टेड, है ना. So I would like to understand, I would like to understand from you कि mostly this either the players or coaches, suppose there is a 7 days quarantine, and post after 7 days quarantine, they again become a negative or positive. If they become negative, they don't, they are more वो लोग खेलने के लिए चले जाते हैं. So what you suggest, मतलब the protocol, standard protocol, what exactly, मतलब as per the standard sports code of conduct, what they're supposed to follow it?
Sir, if someone has the COVID infection, first of all, and they have cleared from it after 7 days of quarantine, and if they don't have any problem with their breathing situations, then they can continue the sports. There's no harm. But it's very clear that after having certain time of like rest, so they have to start conditioning slowly, and then gradually they shall start. If they have some problem with the breathing difficulties again, and they are having something like symptoms like weakness, then they shall follow certain other things like proper nutrition should be given, and very slowly they need to start the exercises. It's not that they can start the exercises suddenly after having 7 days to 10 days quarantine and then they start. No, if they don't have any issues, they don't have any problems, then according to me they can start. No issues with that, because it cannot infect anyone else, and they cannot have any problem with them with their starting also. So it does not have any issues with them.
See, recent
If
one of the,
there is a problem, ji,
yeah.
ji,
So the recent there is some observation where see these are the private the ICMR laboratories.
yes,
We do the test. They do the random testing for random. It's mandatory for all the players to undergo for this testing, na? But they are not able to give the report in time. They are suppose they have the matches tomorrow, na? They are not able to give the report before their match. So it is again extending to the next matches. And sometime it happens that these reports are mismatching. Suppose somebody is negative, but report says positive, and then again it becomes negative. Na? So do we have any check and balance or mechanism like I say international games where it is going on? So you can ask that report whether this authentication of the report can be called by the SI. Is there some system is there with us, or we still believe that whatever the report the private ICM approval laboratory is giving is okay?
sir. According to ICMR, how much I know, that rapid antigen testing could be false negative, could be false positive, as you said. So it is not a confirmatory test. But according to the SI SOPs, recently SOPs have been come. So in that SOP, it has been shown that 5 days quarantine is there, and with the random antigen testing, we can go, and all these things are from the Omicron on the basis of Omicron only, that have been given from the ICMR approved guidelines are there. So 10 days quarantine is there according to ICMR recent guidelines. 10 days quarantine is there with the rapid antigen testing. If there is no symptoms, then you can follow this thing. And if you have symptoms from the last 3 days, like a fever, malaise, or any breathing difficulties, even so your quarantine shall be increased to the 14 days. So this is the basic protocol which has been there.
Thank you so much, Mohit, for giving insight. I am just looking forward the copy of that the circular, okay, so that I can forward down the line to the associated associations so that they should follow strictly.
Okay.
Sure. Thank you so much. Thank you.
Most
Thank you for valuable information.
Is there any other question?
If there is no other question, we can end this session. I would like to thank each and every one of you to join today's session, and especially I would like to thank Dr. Mohit for a wonderful session. Tomorrow also we will be meeting at the same time, that is 12:30. Tomorrow we will be having first aid and CPR presentation. So yes, you all are welcome to join again. Thank you, Dr. Mohit.
Thank you all.